the first time in 23 years as a physician, am I not only able to provide the patient with the best medical care, but I also can help guide them in finding the most cost-effective means of delivering that care without compromising the quality of care.
Welcome to 21st Century Health. I'm Jackie Bales. As healthcare costs continue to rise and the industry focuses on health exchanges, accountable care organizations, and varying payment models, there is an imperative need for collaborative solutions that ultimately reduce healthcare costs and drive better quality for consumers. At IPG, helping their partners navigate and innovate in the rapidly growing implantable device market is their driving force. Jay Etheridge, CEO and President of IPG, is here to discuss these challenges and how IPG is directly impacting them. Welcome, Jay.
Thanks. Glad to be here, Jackie.
Also joining us is Todd Riley, CFO of IPG. Welcome.
Thanks for having us, Jackie.
First of all, Jay, what kind of challenges does the industry face as it relates to the growth of implantable procedures?
Sure, Jackie. One of the things that the implantable procedure market suffers from, just like the broader healthcare market, is really around transparency issues and really not having the visibility to both cost and the quality side of things. There was actually a Time article entitled Bitter Pill, which really focused on this specific issue. And really what that article found was there was significant differences in both the cost and quality related to both the cost of the implantable devices and the quality related to that, as well as if you looked at the overall procedural costs, it can vary up to 50 to 100%. So for the same procedure. So wow. Obviously that's a big difference, and obviously is confusing to both consumers and employers as to why the differences in terms of the cost of the same procedure. So I think that is a clear challenge and an issue. Secondarily, there's really a lack of well-recognized both quality and clinical standards related to implantable procedures. For some procedures, there is good information and good clinical evidence to support it, and others there aren't. And so it's still a real opportunity, both from the physician and the consumer side of things, to understand what to expect from a specific implantable procedure. And I think thirdly, as it relates to medical devices, there's not a specific device reporting or device coding available for the actual devices themselves. It's like in pharmacy, they actually have national drug codes, which they can identify what specific patient got it, they can track it, they can see it on their claims information. That doesn't exist in medical devices. So that is a challenge and an issue and an opportunity.
Wow. So Todd, at a high level, tell us about IPG's unique solution to solve these industry-wide challenges.
Sure, Jackie. Well, we knew we had to come up with a really novel and unique way to solve and tackle these issues. And we knew that we had the advantage of big data at our disposal. We also had the benefit of really leveraging the similarities between the pharmacy benefit management model and our model. And as a result, we created a brand new entity we call Device Benefit Management. And what that's allowed us to do is really take that wealth of information that we have that Jay described and manage it in new and unique ways. What that's allowed us to do is really uncover a lot of inefficiencies in the marketplace and really deliver a high level and recognize there's been a high level of lack of transparency related to implantable devices for a long time. And in doing so, we've been able to now take that information and translate that into meaningful information that our health plans can now use to reduce their costs, improve their healthcare quality, and then pass those savings back through to employers and to consumers.
Really important. Jay, given the size of the implant space, what does the market need for effective strategies as it relates to key industry initiatives and overall healthcare spend?
Sure. I think first and foremost, the priority clearly has to be on affordable care and also improving quality outcomes. And quite honestly, what a specific strategies need to deploy is that you have to have specialized knowledge, in this specific area to really understand it and to impact it. I think that you also need to have create some collaboration amongst all the different health care constituents, both from the health plan and also from the provider side of the equation. That's really critical in order to get everyone working together toward really addressing this specific issue. And then I think lastly, there's got to be better information that's available to both physicians who are making decisions and consumers that are making decisions about their health care.
So, Jay, how does one make a long-term impact?
We have figured out there's about $10 billion in excess cost in the system. So I think what we would gauge is, are we being successful in reducing that cost and addressing that specific issue? And really provide a more consistent, predictable price, both to the folks that are paying for the devices, which ultimately impacts the consumer as well.
Can you tell us a little bit more about the model that has led to the company's rapid growth?
Sure. I think the first and foremost is that what we've had a lot of success in is really normalizing both the costs and the quality outcomes that both health plans and providers experience with our model. That's probably the cornerstone of our model. We also provide consulting support to them to help implement these solutions into their markets and with their members. We're also developing both tools and analytics to provide to both to the physicians and to the payers to help better understand exactly what they're paying for and really kind of understanding what quality outcomes that they could expect. So I think those are some of the, and I think the other areas that we're really focused on is really trying to isolate those standards of care. There are some that exist out there, but I think we can play a significant role in helping to advance that. And so all in all, when you look at those specific solutions that we've implemented, we've been able to impact our health plans spend and actually bend the cost curve 15 to 20%.
Wow.
The cost and complexities involved in managing and maintaining these devices can be a major barrier to outpatient surgical facilities performing routine surgical procedures. As a result, Blue Cross Blue Shield of North Carolina partnered with IPG to provide a comprehensive device benefit management program to participating facilities in their provider network.
We want to help our customers make better decisions with their healthcare dollars. They need transparency in order to make that happen. That's one of the reasons why our partnership with IPG is so valuable to us and to our customers. The IPG platform gives us more actionable information about total cost of care of the whole procedure, best practices around the state of North Carolina, and quality outcomes metrics that we willingly share with our surgeon partners so that they can improve their own processes, make better business decisions for how they run their ambulatory surgery center, and so that they can take better care of their patients.
The transparency and price stability that has come through the implementation of IPG's device benefit management model has had a far-reaching effect on the organization.
The IPG program helps us improve our ambulatory surgery center market offer in North Carolina and makes it more financially sustainable for them to offer a wider range of surgeries and procedures in the ASC itself.
The impact of IPG's unique model does not just stop with the providers. From surgery centers to doctors, patients, distributors and manufacturers, health plans, employers, and consumers themselves, the benefits of IPG's program are substantial.
For the past 9 months, we've partnered with IPG Implant Program. And through them, we've been able to reduce costs. The way this works is they are responsible for obtaining the implants, negotiating contracts with the vendors of the implants, as well as keeping inventory appropriate. And by doing this, it significantly reduces the cost of the surgery center, which in the long run reduces our costs to the consumer, the patient, the insurance carrier.
As with many services of value, IPG's program clearly connects all the dots in the implantable device chain. IPG's award-winning business model allows health plans to implement cost-effective implant management strategies that align the process and the people, and bend the cost curve towards savings and ultimately better care for the patients they all serve.
For the first time in 23 years as a physician, am I not only able to provide the patient with the best medical care, but I also can help guide them in finding the most cost-effective means of delivering that care without compromising the quality of care. Even though some may think that physicians are not that up on the business of healthcare, we actually are. And companies such as SCA, IPG, and Blue Cross and Blue Shield have started to partner with physicians, and by us working together, we truly can make a difference in the cost of health care. This is not only an opportunity for ASCs, but also hospitals to partner with physicians and together find ways to continue to bring down the cost of health care without compromising the quality of health care at all. Today's patient is a savvy consumer. Many of my patients have priced their surgical procedures both at ASCs as well as inpatient hospitals. And on average, the ASC is a third the price of an inpatient hospital. This is tremendous savings, and across the board, it can make a huge difference.
To summarize, why should providers partner with IPG?
Sure, Jackie. Well, as we've mentioned, we bring a tremendous wealth of knowledge and experience to the device benefit management space. And we've been able to really work with our health plans to create tangible, real savings, both in cost and quality, that directly benefit their government, their consumer, and their employer market space. One of the areas that we've added is our health plan efficiency index. And what that's allowed us to do is really, with our partners, health plans, really allow them to compare for the first time how they perform against their other peers within the marketplace and give them really a way to benchmark each other. And we've been able to take that information and collectively create the collaborations between the plans, between physicians, and and to get this information back in the hands of consumers that ultimately go to reduce healthcare costs for all of us.
Wow. Well, gentlemen, it's clear that IPG is not only the thought leader in this space, but that it has existing market solutions that are creating meaningful change and savings for health plans, employers, and patients. So it's nice to see that someone's already tackling this problem and that more and more health plans and providers are taking advantage of these solutions to ultimately benefit our consumers. Thank you for a fascinating discussion and for joining us today.
Thanks, Jackie.
Thanks, Jackie.
For 21st Century Health, I'm Jackie Bales. Thanks for watching.